So for this test, I'll be doing the shoulder apprehension test. This is going to be testing for anterior glenoid instability. I'll have my patient lying down on the table. From here, have them come to the edge of the table and stabilize their arm. You can use your knee as kind of like a leverage. From there, I'll stabilize the glenohumeral joint and push them into external rotation. And looking for any facial expressions going to the endpoint. Sometimes you'll feel the glenohumeral head rise anteriorly. That's a sign of instability. And then you can do the relocation test by pushing it back down, and the pain signs and symptoms should be reduced. So this test is the anterior slide test. This is also testing for shoulder instability. I'm gonna have my patient short sitting. I'm gonna have them place their hand on their hip. From this point, I'm gonna stabilize the shoulder and get a good grasp on the arm. From here, I'm going to put an anterior translation, pushing the shoulder into the joint capsule. And from here, I'm gonna have them push back against me. And a positive sign of this test would be a reproduction of pain, the actual instability feeling, popping or clicking sensations that can occur. So this next test is going to be the empty can test. This is going to be testing for rotator cuff pathologies. So for here, I'm going to have my patient standing, and I'm going to have you bring your arm straight out in front of you and have you point your thumb straight down. From here, you can test these bilaterally. I'm just going to do them together at the same time. So for here, I'm going to ask the patient just to hold this as I apply resistance. And a positive sign would be where they drop their arm, the inability to hold against pressure, pain, numbness, tingling, or any reproduction of symptoms that had currently been occurring. So this test is the crank test. This is testing for a possible SLAP lesion. So over here, I'll have my patient lying down. I'm going to bring them into this position. And from here, I'm going to apply an axial load by pushing the shoulder into the joint. And from there, I'm then going to go into internal and external rotation. And I'm going to ask the patient if they have any pain, numbness, tingling, reproduction of any signs and symptoms, popping and clicking, or any apprehension from the patient themselves. So this test is the Gerber liftoff test. This is testing for subscap lesions or subscapular weakness. I'm first going to have my patient in this position. From here, I'm going to ask them, can they go ahead and lift off back? So if they can bring their arm back, which she can. So from here on, we can assess that there is no subscap lesion. So we can assess weakness from this point. So from here, I can have them in this position, and then I can have them resist against me as I try to push them back against their back. And a positive sign of this would be muscle weakness, where you can push them back, or pain, numbness, tingling, or any reproduction of current symptoms. So for this test, it's the crossover impingement test. This is going to be testing for pathologies anterior, superior, and posterior of the shoulder, also any impingement that can be occurring. So I'm going to have my patient short sitting, and from this position, I'm going to stabilize them and have them go, go into horizontal abduction. So from here, I'm going to stabilize and move them in. And I'm looking for any pain or discomfort from the patient in the anterior, posterior, or superior portion of the shoulder. I'm also looking for any numbness and tingling that can occur, which could indicate impingement around the ACE joint or within the joint itself.